it's obscene in any context to kick people off healthcare, but particularly in the context of a pandemic.
Which side are you on? Which side are you on?
The COVID-19 pandemic, there was a national emergency that was instituted by Trump, right, at the beginning of the thing. And now the Biden administration is looking to wind down. And there have been some good pieces about what that is going to mean for workers in Alabama. So walk us through that, Adam.
Yeah. So just to back up, since the start of the COVID-19 pandemic, we've experienced over 100 million cases in the United States, with over 1 million deaths and millions more disabled. I think you have to start there by acknowledging that reality. And while we've certainly come a long way here in, it's almost March 2023, so we're, a few years into this, we've come a long way. We shouldn't forget that the disease continues to infect, disable, and even kill our brothers and sisters across the country. The Biden administration has officially declared an end to the, quote, public health emergency of COVID-19. But that is a lot more than just rhetoric. It is a distinct policy shift that's going to impact millions of Americans. First up, I wanted to look at the impact this will have on hunger in Alabama. A recent article by Carol Gunleck of Alabama Rise titled "End of Emergency SNAP Allotments Will Increase Hunger in Alabama" breaks it down for us, and you can find that on Alabama Rise's website. I believe is also republished by the Alabama Political Reporter. As Carol notes, the public health emergency meant temporary increases to SNAP, the Supplemental Nutrition Assistance Program commonly known as food stamps. These temporary increases to the benefit will expire at the end of February. Quote, nearly 400,000 Alabama households will see average cuts to their SNAP benefits of around $170 a month. Particularly hard hit will be older adults and people with disabilities who live alone. Before the pandemic, SNAP benefits for these households could be as low as $16 per month. Emergency allotments boosted these folks' benefits to the maximum of $281 per month for an individual. But with these increases ending, all of these participants will now see their food budgets decline, possibly to as little as the current minimum of $23 per month. So that's, a pretty significant impact that's going to have on hundreds of thousands of folks right here in the state of Alabama, to say nothing of course, the economic impact, right? These folks will have less money to purchase food. Therefore, ostensibly, we can assume there's going to be less food purchases. So there's going to be an economic impact there, but most importantly, there's going to be a real human impact with people's food budgets being slashed. So the end of the COVID emergency is not just, a milestone. It's not just a rhetorical thing. It's going to have a real material impact on people's budgets and people's livelihoods. And while state and local officials can't stop the expiration of these temporary SNAP benefits, that's a federal decision, Carol does point to some things that the Alabama legislature could do if it wanted to address food insecurity among our fellow Alabamians. Of course, as we've discussed frequently on the show, Alabama could remove the sales tax on groceries, which would be the equivalent of about an extra 2 weeks worth of groceries for folks, once you account for that discount, more or less. Alabama is one of only 3 states in the country to fully tax groceries, and Arise has been a longtime champion of repealing that sales tax, which disproportionately punishes the poor and working class. Arise also recommends local school districts to expand free school meals, including summer meal programs, and encourages eligible school districts to adopt the community eligibility provision if they haven't already, in order to expand their food services. And that's very important. It allows schools to have basically blanket free meal programs where instead of having to have every child, turn in their documentation about their parents' income and all that, there's some schools where you already know the high poverty level in the school, and so a lot of those schools are eligible for this community eligibility provision, where they can easily expand their food services and even offer supper services, summer feeding programs. That's huge. That is a huge benefit for families and for young people. So many of our students rely on the meals provided at school. It's the only stable hot meal they have from day to day. So there's a lot there that school districts can do to try to fill that gap. It's unfortunate, as always, public schools are often left to fill the gap in our social services. Alabama Rise also encourages the legislature to provide state funding to the Double Up Food Bucks program, and that offers extra fruit and vegetables to SNAP participants. It's a good program, but it's currently hampered by a lack of state support here in Alabama. And finally, on that note, it's worth remembering that back in D.C., Congress will have to reauthorize the Farm Bill, which would be an opportunity to expand SNAP to lock in some of these supplemental benefits that are set to expire this month. But obviously, given the Republican takeover of the House of Representatives, that seems less and less likely. But it isn't just food security that's going to be impacted by the end of the public health emergency. It's also healthcare and, of course, our response to the virus. I want to point you to a recent article by Allender Roca with the Alabama Reflector, published February 15th, What the End of the COVID Emergency Means for Alabama Medicaid Coverage, Monitoring of the Virus, Both Likely to Decline. So the end of the COVID emergency is going to change what we know about the virus's activities. It's also going to affect the state's Medicaid enrollment. The public health emergency actually required Medicaid agencies to keep people enrolled in the program, even if they no longer qualified for it. Basically, as long as the emergency was in place, no one was supposed to be kicked off Medicaid. With the end of the emergency, there's going to be people losing their health coverage through Medicaid, though the exact number of Alabamians is not really clear. Nationwide, it's estimated up to 15 million people could lose coverage either in Medicaid or through CHIP, the Children's Health Insurance Program, when this emergency ends this month. 15 million people potentially losing health care. It's just an enormous toll that's going to take on the working class of this country. Just a few reminders here. The Medicaid continuous enrollment provision that was part of that emergency declaration was effectively discontinued last December. States will begin taking people off Medicaid on April 1st, ahead of the end of the PHE. And the Reflector goes on to talk to a couple folks in the article, including Director of the State Health Reform Program and Associate Director of the Program on Medicaid and Uninsured at the Kaiser Family Foundation. That's Jennifer Tolbert. Now, Ms. Tolbert was a little more positive. She seemed to think that children in Alabama would not be impacted, at least not for some time. Children are provided continuous coverage for 12 months and cannot be kicked off the program during that period. So that's some good news, I suppose, in the midst of some very bad news. But she does go on to say that, quote, in a state like Alabama, there are concerns that adults, parents, in particular low-income parents, are at risk of losing coverage because the state has not expanded Medicaid. So many parents who did qualify during the pandemic will lose coverage once the disenrollment begins. So that is a major impact we're going to see on the working class of Alabama and across the country. And it's not just the healthcare aspect, but the actual response to the virus as well is going to change, because the end of the public health emergency means changes to COVID-19 policies and COVID-19 reporting requirements, right? There's going to be less requirements for securing COVID-19 lab results and vaccine data from labs, for example. So the reporting of negative test results, the ability to even calculate like how many people are currently positive with COVID-19, that's going to be diminished. And for me, I'm just speaking, personally here as someone who's by no means an expert in COVID-19 or in healthcare. That worries me, right? We have this disease and we are more or less declaring victory, and we are going to diminish our ability to monitor this disease and monitor its impact, monitor its spread. So, I think that's very concerning, especially, we've seen various strains of COVID come along over these past few years. So, I'm just hoping and praying that we don't have, really wicked strain come through right as this emergency has ended and we are less able to actually respond. The United States did a particularly poor job of responding to COVID-19 by most metrics. I know there's a lot of debate about how various states responded, how the federal government responded, but, if you just want to look at the bottom line facts, when it comes to death, when it comes to disability, when it comes to infection rates, the United States clearly failed compared to most of our peers on the global stage. So to know that this emergency is ending and our monitoring, our testing, our response to the virus is also diminishing with this end, at the same time that we're taking food out of people's mouths and we're taking healthcare away from folks, it's just very disturbing. And I think that is something that has been underreported, frankly, the way this is going to impact regular folks across the state and across the country.
Yeah, I would agree with that. And particularly the stuff about people getting kicked off Medicaid.
Right. I mean, because to me, that's the nightmare scenario is, okay, a couple months from now, we're doing less testing, we're doing less monitoring. We don't even really know where COVID's at, how many people have it, where it's spreading, where the hot spots are. And oh, by the way, here's a few 100,000 more people in your state without health care.
Right.
What could go wrong?
Right.
So, I think there's going to be a lot said and written in the years coming up about the United States response to COVID, both in the Trump administration and in the Biden administration. But I think this declaration of victory, so to speak, and the turning over of the response to the private sector, I think we're going to have some long-lasting impacts here. It's easy to think of now, and it's February 25th, 2023, that we're kind of over COVID, that we've made it through the other side. But I really do think there's going to be some significant impact on working people with this.
Yeah, definitely. I mean, no doubt. Absolutely no doubt. I mean, even aside from the idea about the COVID stuff, just people getting kicked off Medicare and losing their health insurance is bad enough.
Right. I mean, that's obscene in any context, right? The idea that someone would lose health care. I'm a humanitarian, and I believe that people deserve health care just because they're human beings, just because they're my brothers and my sisters living on this planet with me. I think they ought to be able to go to a doctor in a hospital or in a dentist when they need to. And that's considered a radical idea in this country. I don't think it is. It's certainly not in most other developed countries that guarantee health care as a human right. But yeah, it's obscene in any context to kick people off health care, but particularly in the context of a pandemic.
You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project. And you can do that on our website, tvlr.fm.